what we're talking about is a general rule and a general solution to this whole problem has been running around out there that since we don't have the money, why can we not have all the employees in town take a 10% pay decrease?
Yeah, I've heard that, and that's certainly an interesting concept. First of all, it's confronted by several different things. The majority of our employees are represented by a variety of different unions. There are 11 different unions in town. That includes both general government and school, as I recollect the time. So that, in and of itself, is a bargaining issue, and one side cannot impose on the other side something that has to be negotiated to a settlement. But then if you also start to think about, I guess, a different argument, which is an equity argument. If you take somebody who's earning $50,000 and you say, okay, to solve this problem, you need to take a $5,000 pay decrease. Whereas there's another solution being offered out there, in part to solve the problem, which is people participate in it. Everybody who's got a dog in the fight participated to some extent, which is the debt exclusion discussion. That gets into an equity issue. And that's the argument I'm making, by the way, to the unions, which is everybody really does need to participate in this solution, which is why I'm looking for health insurance reform, in essence, in terms of employer or employee contribution. That, if in fact we can get that, and it's a big if, because again, we're bargaining with 11 different bargaining unions in order to do that, the impact to the individual employee, for instance, in a family group, would be in the neighborhood of probably about a 4% wage impact. If you look at going from, for instance, a 90-10 split, which is what we're currently at, to a 75-25 split, it has the impact of something in the order of about $1,800, $1,900 for a family plan, as an example. And so that's how we're approaching it.
How's that going?
Well, I can say how it's going without getting too much into the detail, because as you know from bargaining, there are restrictions as to what I can say publicly about that. We've been having a whole series of meetings on it, and meeting on it for many months now. Naturally, there is reluctance on the part of the unions to do that. I think that as the fiscal situation becomes more evident and people are beginning to recognize it as something that may not be short-term in duration, but in fact may be of a longer-term duration, that the willingness to consider that has increased. Now, whether or not we're actually going to be able to cross that goal line or not remains to be seen, but I know I am pushing that very hard in trying to get to an appropriate resolution. My core argument is it is better for all of us as employees to participate in the solution, to preserve jobs for those folks that are standing next to us, because I think it is really, in this environment, it's a very, very traumatic event for somebody to lose their job, and it could have a very, very deep and lasting impact on their family lives and community. And so I am really kind of playing the decency card, for lack of a better term. And I also think that the general public, if we're asking the taxpayer to contribute to solving the problem, because the taxpayer has certainly a motivation to help to solve the problem, in terms of delivery of service and quality of life and so forth, the employees ought to also participate in that. And I've gotten some positive response from some employees, and I've gotten some negative response, but we're going to just keep hammering away. I don't think that you would get the reduction, for instance, in the health insurance split if A were the result. I think the employees would say, if you want us to do this sacrifice, it has to be contingent upon, for instance, a debt exclusion passing, because part of why we're doing the sacrifice is to preserve services, and services in cities and towns means staffing, because that's what we primarily, all of our functions require people to execute them. So I think it would be unlikely, for instance, for people to say, we will go to a different split on health insurance, and we still end up with the same departmental makeup as is configured in A, as an example.